heel pain is a very vague term. You might get heel pain in multiple conditions. First and foremost reason for heel pain is plantar fasciitis. The kind of pain what you experience, what we call it as heel pain, is a sharp shooting pain. Most of the times, the pain is when you wake up from the bed and try to walk for a few steps. You feel a sharp shooting, burning kind of pain. You're not able to take few steps. But suddenly, once you are walking and doing your routine activities, the pain subsides. Similarly, if you're sitting on a chair for long, again getting up, the pain starts. That is the typical presentation of heel pain. You might have swelling in the heel region, or you might have swelling around the ankle or a heel. That might be related to some tendinopathies like Achilles tendinitis, or you may have posterior tendon, tibial tendon insufficiency. You might have peroneal tendinitis. So all these collectively cause heel pain. Many times patients they have flat foot. So the shape of the foot has become flat and protruded. So in those cases, you have frequent heel pains, and patient if not wearing proper footwear, they also encounter heel pain. So common causes for heel pain are, like I said, plantar fasciitis, Achilles tendinitis. You may have heel fractures. You may have some injuries to the tendon. You may have flat foot. You may have been wearing improper footwear. You may have done some extra activity, overuse of your tendons. So that also causes heel pain. The plantar fascia is the main muscle or the tissue which helps in maintaining your arch. Your foot is not flat; it is always having an arch, which is helping you act like a spring in your leg, so that you, when you are walking or standing or doing things, you don't feel weight on your leg. But if this plantar fascia is not working, you would get a lot of pain while getting up. That, like I said, getting up in the morning or getting up from the chair when you're sitting for long. So this plantar fascia gets hurt because of three things. One is improper footwear. You're not wearing good shoes. The soles are flat, or you have heels. You're wearing heels, or you have flat foot, or you have improper sleep. If you're not sleeping for 8 hours, the muscles are very sensitive to your sleep habits. So if you don't get sound sleep, if you're not sleeping for 8 hours, you have some problem with your schedule of sleep. Then you get this plantar fascia. It is very common. Achilles tendinitis, contrary, happens when you have just started running, or you have started some physical activity like trekking, hiking, or you are doing some activities which are increasing load on your foot, like climbing stairs for long, or maybe standing for long, or maybe you have recently started with these exercises of running, jogging, jumping, and suddenly you have stopped it altogether. So that means that the muscle is fatigued and the muscle is tight. That is not allowing you to have any relief while you are walking. The other muscles which help in maintaining the arch is the tibialis posterior tendon or the peroneus tendon. These two muscles are also sensitive to your sleep. So muscle tendinopathies also happen when you are overusing them, like sitting on a low chair, low sofa, or cross-leg sitting. So frequently turning inwards your foot, like walking on an irregular surface, or walking uphill or downhill. So all these causes increases the problems in the heel, and then you get the heel pain. You might have jumped from a height, you get a fracture in your heel bone, which is the calcaneum bone, and that leads to swelling. And if that fracture is healed in an improper way, you have pain while walking even a few steps. So that is a different condition where you need a plaster or some support for you to walk. Whenever the patient comes encounters heel pain, he should think it as serious, and he has to treat his heel pain as early as possible. Pain in the heel is quite disabling. Many times, people who are working on night shifts, or they change their shifts, they don't have sleeps or 8 hours of sound sleep. So in those cases, you get heel pain immediately. Next thing is postpartum period, that is post pregnancy. You have a child, you have a baby who is not allowing you to sleep for 8 hours. Your muscles are fatigued. You get the heel pain very commonly. Next is your shoes. If you're using the same shoes for long time, and you're not changing it frequently, and you are walking and standing and doing things every now and then, standing on the heel for long period of time, like professions like policemen, teachers, even doctors, even people who are standing for long for traveling or any other case, they also get this kind of heel pain. and this becomes very disabling because every now and then if you want to get up with the heel pain. So any heel pain, if you feel it is not getting better with the normal rest or anything, you have to visit the doctor. Heel pain has a multivariate factors, multiple causes. So important aspect in your heel pain is the sleep. You have to have 8 hours of sleep if you have plantar fasciitis. If you are not having proper sleep, this pain, even if you are giving medication, it will come back again and again. Next thing, like I said, is improper footwear. If you have a flat foot, you have to have a arch support shoes. You can use insoles in your foot, in your footwear, so that would help you in relieving the plantar fascia. If Achilles tendonitis is there, you have to wear shoes which are ending above your ankle. That is high anklet shoes. So in those cases, you are not loading your ankle joint. Then the pain would go down. Other muscles, easiest thing what you can do is give it hot and cold fermentation before you're going to sleep. So if you are having heel pain, every night you have to get a bucket of warm water, put salt in that, move your ankle up and down 10 minutes in warm, 10 minutes in cold. That would help you in a soothing effect for your fatigue muscles. Other thing what you can do is use a water bottle, you can put it in the freezer and just roll it below your heel to reduce the pain of the heel and give a soothing effect to the muscles. Other thing is stretching exercises for your plantar fascia. You can just hold a towel and pull your ankle towards you. Hold it for like 5-10 seconds and repeat for 10-15 times every morning when you get up from the bed or whenever you are getting up from the chair. Many times the pain is intractable, there is no change, even the exercises are not helpful. So people, they recommend getting an injection. Previously, steroids were very rampantly used, but these steroids, they cause the muscle to get torn out. So long-term effects of steroids are very harmful. I would not recommend any person or any patient with the steroid injections in the foot or in the tendo Achilles muscle. We can give a newer technique, which is the PRP. You can give a plasma-rich precipitate where you inject this blood. You can take the blood out from the patient, you centrifuge it, whatever the precipitate comes, it has a very good potential for healing. We inject it at the base of your plantar fascia, at the origin of the plantar fascia, or any area where it pains, like the tendo Achilles insertion or any other muscle insertion. That has given promising results in many patients who are not getting better with a normal treatment or a conventional treatment. So that is one more aspect of treatment which I would like to highlight. Other thing is, if it is not getting better, then we can release the plantar fascia. We can release the muscles which are tight. That is a surgical option, which is a last resort. You don't need a surgery for plantar fascia pain or a Achilles tendonitis. But many times the intractable pain in patients who are not getting at all any relief, in those cases we can use the same the surgical option. Other stretches, calf stretches you can do. You can stretch your hamstrings. You can also try to use a towel. You can put the towel down on the floor and try to pick up with the two toes and try to relax and contract the muscles of your foot. You can also do some physiotherapy exercises. The physiotherapist will teach you those exercises, which you can follow it at home. Every time you have to do some sports activities, some adventures, some extra activities what you are not doing normally, you have to wear a proper footwear. Many times you wear a formal kind of shoes which have a closed toe box. Your foot is not accommodating properly in that. In that case, also you get the pain in the heel. So in those patients also, I would advise to wear some arch support footwear or wear a round toe box or a square toe box shoe where your foot is accommodating very fine inside the shoe. Prevention is having a healthy diet where you eat a lot of protein, you eat a lot of supplements, you have green leafy vegetables which contain lot of constituents of your muscle wear and tear. You also have some citrus fruits, so vitamin C is also available. You can also have 8 hours of sound sleep, which is most important in my opinion to have no heel pain. You also have to sit in the sunlight. You have to get the vitamin D. You have to eat food which is not increasing your weight. If there's another cause of increasing weight like thyroid or any diabetes or any other comorbidity. So you have to treat the cause and get the proper treatment for the same. You also have to continue with your normal routine exercises. Exercises are very important for you to have your muscles and your bones in action.